I'm glad you're here. This is a very important day. We're so happy that the Board of Nursing, we actually have 2 members from the Mississippi Board of Nursing here, and we're just delighted that they're here. I gave Kathy some questions last week that I had for you, so we're going to let her speak and talk, and she's going to introduce Talisha Greenlaw also. And if you have questions, she said it would be okay if you stand up and ask the question. That would be fine at the end when you ask the question. If you don't want to ask the question yourself, you can, Ms. Randolph, raise your hand and stand up. She has a Post-it note with pencil, so if you will write your question down, maybe it's something you want to ask anonymously, give it back to Ms. Randolph and she'll get it to us during the question time. Does that sound good? Okay. I want to introduce Kathy Elliott. Ms. Elliott joined the Mississippi Board of Nursing in October of 2014 as the Director of Licensure and Practice. Prior to joining the Board of Nursing, she served as the Director for Career and Tech Education at the Mississippi Community College Board. She has over 24 years experience as a registered nurse and over 18 years as a nurse educator in the practical nurse setting. Practical nursing. So our practical nursing program is here also. I don't think I told you they were coming, so we're glad to have them. Her nursing career started with an associate's degree from Meridian Junior College back then, community college now. It was. She worked in medical surgical nursing and home health, then began teaching allied health at Jasper County Career Development Center. The next year she went to practical nursing instructor at East Central Community College. We had changed to then. Then practical nursing at Jones County Junior College. And that's the only college in the state that still kept junior college, even as of today. She earned her Master of Science in Nursing from William Carey in 2007. Served as director of the practical nursing program at Jones. Received a specialist degree in higher education administration from William Carey, and congratulations, is pursuing a doctorate in higher education at William Carey, so that's great. Ms. Elliott also has traveled extensively across the country as an NCLEX RN and NCLEX PN live review educator for ATI. She's a past member of Sigma Theta Tau Honor Society, Association of Career and Tech Education, and served as a faculty advisor for the Mississippi Licensed Practical Nurses Association. And she's going to introduce Talisha later, and we're just honored to have you on our campus. We're going to give you a tour later, and enjoy having you around this afternoon. And the topic, what she's going to start out talking about, she can talk about whatever she feels the need to, is how to get and how to, especially how to keep your license. So, thank you.
Good morning. Thank you so much for coming and inviting us to be here with you. The Board of Nursing I'm new here since October, and we have a new executive director, and so we are really trying to get out to the colleges and out into the communities to let nurses know what our role is here, and to also to not, I used to think of the Board of Nursing as the place I never wanted to go. Because generally when you went to the Board of Nursing, after you got a license, it was because you were in trouble. So we're trying to promote some education about how to keep your license. Feel free to come and visit us anytime. We have hearings and things like that. So when Dr. Lynn Langley is our new executive director, and she was going to be coming down, but she got called to the Capitol. This is the legislative season, and right now appropriation bills and things are very important. So she had to go there this morning, so I came along and I asked Talisha to come with me. So I'm just going to talk to you for a few minutes about the function of the board and what we do. Talisha is very experienced with the application process. She's a licensing officer with the board, and she's going to talk to you about the application process, the NCLEX process, and then getting your license. so that you're very comfortable in understanding how that process works and why it can be a little timely at times. It's not a real quick turnaround. But the Board of Nursing, and many of you, are you all levels of nursing? We have PNs, we have first year RNs and second year RNs. So some of you are closer to graduation than others. But it's never too late or too early to learn a little bit about what our function is. For years and years, when I was a nurse, I really thought the Board of Nursing's main job was to license nurses. And while that is a function of the Board of Nursing, the actual mission of the Board of Nursing is to protect the public. We are a consumer protection agency. We are charged with protecting the public from bad nurses, basically, to make sure that patients are cared for in an appropriate manner and that nurses do no harm. Now, how do we do that? Well, we set the Board of Nursing office. We have about 30 employees and we have several divisions. So I'll just tell you a little bit. We have the executive director, and we have the division of licensure and practice for RNs and LPNs, and I'm the director for that. Underneath the licensure and practice division, we have our licensing agents that do licensure by exam, which will be what y'all will do. Initial licensure by exam. We have an agent that does endorsements for nurses that are already licensed that come across, that want to come into Mississippi. We have the hemodialysis technicians that we also certify. A little oddity in the Board of Nursing because they're not nurses, but something that the legislature asked us to take on about 2008 or so. We have a legal division. We have two in-house attorneys, Brett Thompson and Wesley Muthiger, and under them they have investigations. We have about 4 investigators. We also have the criminal background check section. We have Dwayne Jameson and Sharon Ferris, who will be coming out. Have you all been fingerprinted yet this semester? So you, if you haven't been fingerprinted by the Board of Nursing, you'll have to do that before you can take your NCLEX. And so usually your school will set that up. So we have fingerprinting, and the fingerprinting results come back as a criminal background check to the Board of Nursing. We also have a recovery nurse program, where nurses that have that are addicted to alcohol, drugs, whatever, have some type of substance addiction, that we work with in an effort to them to keep their license. The Board of Nursing is not interested in taking people's licenses. What we are interested in is trying to help nurses understand what it is they may have done wrong, educate them on why that was wrong, and then in the RNP program, that recovery nurse program, to help educate them and to get them to work through their addictions and also be able to work as a nurse. And I think the last division is the advanced practice division, and we have an advanced practice nurse director, an investigator that's assigned just to the advanced practice nurses, and also a licensing officer just for the advanced practice nurses. So if you are planning on becoming an advanced practice nurse in the future, then that's a whole another section. So we do the job of what our board tells us to do. Basically, we carry out the everyday functions of the Board of Nursing, but we are basically guided by a a 12 or 13 member board. I think it's 13 members, but I think right now we just have 12. But we have about, and I haven't memorized the exact breakdown, but it's about 7 RNs with a variety of backgrounds. Some have associate degrees, some have bachelor degrees, some are advanced practice nurses. 7 RNs, 4 LPNs, a medical doctor, a nurse at large, and then a consumer protection person. Generally, that's just like a consumer at large, like somebody that's not a nurse, but that might someday be a patient or has been a patient. And so the people on the board are nominated by they're really nominated first by the Nursing Association. You have to be a member of a nursing association. It could be MNA, it could be the Mississippi LPN Association, it could be the Advanced Practice Nurse Association, the Nurse Anesthetist Association. There's a variety of associations, but that starts there. They choose someone and they submit that name to the governor. The governor reviews the resumes, and then the governor selects the people that are to be on the board. And the board meets every other month. We have a business meeting every other month that's open to the public, and we also have hearings the 2 days preceding the business meeting, where we have basically disciplinary hearings for 2 days, all day. And they're also open to the public. Do y'all come down any at all for the, if you would like to come down, you can make arrangement with Jackie Allen, who handles the scheduling of that, but you can come in for part of the day and just sit and listen. It's very interesting what goes on in the disciplinary hearings. So that's kind of, that's just an overview of what the board does. And so one of the questions that was posed to me was, how do you go about keeping your nursing license? And so I'm just going to talk to you a few minutes, and then Talicia's going to tell you how to get it first. But when we talk about keeping your license, it means that you act within your scope of practice, you do no harm, and that you do whatever the board asks for you to do in terms of, if it's, right now we don't have continuing education units, but that may be something that we see in the future. And keeping your license active, renewing it every other year as directed by law, keeping the board informed of address changes, name changes. As I spoke to the attorneys several days ago about, tell me a little biggest problem. So we're going to talk about really the 3 main things that we see with discipline. By far the leading discipline issue, and also issue that causes the most nurses to lose their license, is drugs and drug diversion. So does anybody want to, all right, do you mind if I ask you a couple of questions? Or, I'm sure nurses are not shy people. So what do I mean by drug diversion? Anybody want to take a stab at that? Oh, y'all are shy? Okay.
Not giving it to who you're supposed to give it to.
You're diverting drugs, not giving it to who you're supposed to give it to. Because you're usually doing what? Giving it to yourself, okay? Or you're taking it home to someone at home to take it. And so drug diversion is really, it is appallingly popular, and very sad to hear some of the stories in the hearings about these nurses that practice drug diversion. Because what happens is these nurses all started out just like you. They wanted to be a good nurse. They wanted to be a nurse. I mean, you have to want to be a nurse to go through the hell of nursing school. I mean, because it takes fortitude to stick it out. It's not easy. You have to give up a lot of your life for 1 to 2 to 3 years, however many years your track is. But they start out like that. And what happens is, in practice, they find out that, and they see that they're able to kind of mess with the system. Oh, I've got a headache. I've got a bad headache. Or I pulled my back last week taking care of this patient. And so you've got, the reason why nurses divert so often, many, is because they have access to the medication. So you go in and your back is really hurting and your patient down in room 104 is complaining of a headache. And so you might give them Tylenol for their headache, that if it's ordered, and you might pull a Lortab and put the Lortab in your pocket and chart that you gave the Lortab to the patient rather than charting the Tylenol. And the nurse is going to be very afraid for a little time, particularly that day, that somebody's going to what? Somebody's going to catch them. And a few days goes by, and nobody does. So now the nurse, and y'all, this is part of human nature. It's a twist in our brain. It's that nobody caught me, so somehow I therefore have permission. I didn't get caught. It's the hospital's fault. They should have caught me. So now they say, I haven't gotten caught, and I'm going to do it again. And they do. And then they graduate from PO medication, like Lortab, which I know is no longer in existence. Norco is the, but then they graduate to injectables. Just in December, we had a case review, which one of the most fascinating things I think of my job is to sit in on case review. And we review, when the Board of Nursing gets a complaint, we have to review and investigate every complaint, no matter how silly it may seem. So we got a complaint from a hospital that said they had fired a nurse because they felt like the nurse was diverting. And they took some pictures and sent to us. And so this nurse had requested a vial of morphine from the Pyxis system. But in the, how you request, you go in, but then a couple of hours later, the nurse put the vial back, like they had gotten it out in error. Well, the next nurse came along that needed that same medication, and that vial dropped out. And when that nurse picked up the vial had dried blood all over it, and while the flip-off cap, while it was still intact, there was one of the pieces missing, so it was loose. They took that vial up to the pharmacy, who measured its specific gravity of the medication in there and compared it to a vial that had not been tampered with, the specific gravity of that. And you know that specific gravity is the weight of something as compared to water, sort of. I'm not a scientist, but the vial that was tampered with had a specific gravity of close to 1.0, but the vial that had not been tampered with had a different specific gravity. So what they found was it was diluted, and what the nurse was doing was taking medication out of the vial, injecting himself while on duty, and replacing the lost medication with saline. So when the patient when that vial was redrawn from the Pyxis, and maybe you couldn't tell that it had been tampered with, if, in a different vial, nurse unknowingly would draw up saline to give the patient rather than the medication. You think I could talk after being a teacher for a long time, but when you stop talking a lot, you lose your voice when you're talking. So that's an example of diversion. That's a real life example of a diversion. So now that nurse's case has not come before the board yet, but all of these details are public information. Okay, I'm not sharing with you anything that's privileged. That's public information. So, in addition to diverting narcotics, and which is a violation of the nurse practice law, there potentially could be an issue, did that nurse break the law? They took medication that was not prescribed for them. They also deceived the public. They deceived those patients that were getting that saline rather than their Demerol. And so, the Bureau of Narcotics could get involved in this. So and diversion is not just a problem amongst nurses. It's a terrible problem amongst physicians, an absolutely horrendous problem amongst nurse anesthetists, because you have such access. And so a few years ago, one of the things that they're doing to combat this problem is something called the Prescription Monitoring Program. PMP is what we call it at the Board of Nursing. And anybody that's ever gotten in the last couple of years, I'm not sure when exactly it started, but I didn't even know it existed until I went to the Board of Nursing. So when we have somebody that we think is diverting, the first thing we do is we go and pull their profile through the prescription monitoring program. And so that's something that you all need to be aware of as future nurses, that the medications that you are prescribed, any controlled substance, goes into a database. Let's just say Kathy Elliott. If I pull my PMP, it's going to pull up every controlled substance I've had prescribed to me or had filled over the last. You can set your time parameters, and it will tell you what the drug is, how many was filled, what date it was picked up, how it was paid, the doctor, who prescribed it, and the pharmacy where it was picked up. And then down at the bottom of the page, it will tell you how many doctors that I see, how many different pharmacists that I use. Because I believe the legislature last year passed a law that doctor shopping was illegal in the state of Mississippi. And that's what we had. You know what doctor shopping is? You go to one doctor and you get some Ativan. You go to another doctor and you get some Dilaudid. And you go to another doctor and you get another prescription of Ativan. And prior to this PMP, people were doctor shopping all the time. And they were going to different pharmacies and just a whole variety of ways to get a hold of a lot of drugs. So the first thing that we would do with drug diversion is we would pull your profile, a nurse's profile, to see what's going on with them. Are they taking a lot of medication, or are they paying for a lot of medication? Nurses don't always take what they're prescribed. Why? What are they doing with it? They're selling it. They're selling it. It's a fairly profitable business to sell prescription drugs on the side. And so that's when, if that was suspected, the Bureau of Narcotics would definitely get involved. So there's a lot of layers to what we do in terms of drug diversion. The second most common problem with discipline with the Board of Nursing is documentation problems. primarily either the lack of documentation or falsifying documentation. Recently, I looked at a chart and they had electronic health records. And the nurse had charted, hey, click, 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 you know how you check the buttons? Everything was fine. The patient's urine output was normal, voiding well, or whatever was that check. Well, but then at the end of the shift, there was no urine output documented. And ultimately, the patient had to go to the hospital, the patient had a urinary retention, had to get a catheter put in, subsequently got an infection, which subsequently the patient died from. And so someone complained about this nurse, and because they thought, I don't know who it was. It can be anybody. It can be another nurse. It can be anonymous. Sometimes facilities just turn nurses in when they do a chart audit and see that there's something going on. So when your teachers tell you, if you didn't document it, you didn't what? You didn't do it. Your teachers, they know. They're not just telling you this for their health, okay? They're telling you because they know. If you don't document what you do correctly, that can be used against you in a discipline complaint, or a complaint against you and then a discipline action. So, documenting appropriately. Telling the Board of Nursing that you were too overwhelmed at your job to get your documentation done is not a satisfactory excuse. Okay? If you're too overwhelmed, then you may need to look for a different job. If your employer puts you in positions where you feel like it's unsafe, you need to find a new job. It doesn't matter what they're paying you per hour if you can't do the job appropriately. If they're paying you $50 an hour or $100 an hour, ultimately you're going to get in trouble. You're going to find yourself in trouble. And then you'll hate nursing forever. And we don't want you to hate nursing forever. The other thing that gets you into trouble with the Board of Nursing is not communicating with the Board of Nursing. And when the Board of Nursing, if you get something to your address from the Board of Nursing, open it, read it, call somebody immediately. Y'all would not believe the number of nurses that come in and we say, well, we sent you a certified letter. We do certified letters, return receipt requested. You signed for it. Thank you. You signed for that letter. But guess what? You never did what? Never called. You never called. Because if I was to get a Board of Nursing letter, it would scare me. But it doesn't have to scare you. It may make you a little nervous, but call and find out what they want. Because we've had nurses that have lost their license. Their license has been revoked because they just don't come to a hearing. And if you have a discipline issue, the Board of Nursing tries to work with you to resolve that. They might try to get you to accept, say, a fine or a fine in a class. The last thing the Board of Nursing wants is for you to come to the hearing. Have to come all the way to the hearing and be heard before the full board and plead your case. Now, if you think you're innocent and you think there's, by all means, hire you an attorney. Don't come to the Board of Nursing without an attorney. It's amazing. This is your livelihood. You have to protect it. But the best time to protect it is best to be proactive. Do what you've been taught to do the correct way, and communicate with the Board of Nursing. We just recently had our renewal cycle for RNs. December 31st was our last day to renew on time. On January 1st, we had around 42,000 RNs that had renewed, but we had 4,890 RNs that did not renew. If you don't renew, your license is expired. If you go to work on January 1st and you practice nursing, now you're practicing nursing without a what? So that's a big area of concern that we see over and over. People forget. It won't affect you all. In the future, we have purchased a license management system, and so you'll see that it won't affect those of you that are graduating in May. Okay? It may affect some of you in August, July, August, but we're gonna, everything's gonna be online. You will set up a username and password. You'll have a gateway that you go in, set up a username and password, and you'll take care of all of your nursing, Board of Nursing business online. No more having to print out papers and stuff. You pay online. So we're looking forward to that. And another question that I think Dr. Bynum had for me was, and it kind of goes back to that prescription monitoring issue, is what is the Board of Nursing stance on nurses that take controlled substances while they are working, even though they may be prescribed? And so I talked with the attorneys about that, and the Board of Nursing does not have a stance on that per se. But nurses are charged with the understanding and knowledge that they will not perform nursing activities while they are impaired. And if you've been taking Xanax for the last 5 years, chances are your body is accustomed to that and you function just fine. So your hospital or healthcare agency where you're employed, they may have their own policies and procedures regarding that. But just because you have a prescription for a controlled substance doesn't mean that you can just take that anytime you want and go to work. You have to understand that if your Norco makes you loopy, and because y'all, they affect the central nervous system, so therefore it may affect your judgment, your decision-making skills. And so if you go to work and someone suspects that you're impaired, then at that time probably what will happen, they will ask you to submit to a drug screen. And you may say, well, I've got a prescription for that. And you may have a prescription for that, but you cannot work impaired. So the hospital or healthcare agency is the one that decides really how to handle that. And, and it could be if you are impaired and they could report you to the Board of Nursing for investigation because you worked while you were impaired. Just like driving a vehicle. Your driver's license is a privilege. It is not a right to have a driver's license, it's a privilege. If you drink and drive, you're not always going to get caught. But if you do get caught, you're going to lose the you could lose the privilege to drive. And so, you may take Lortab for a bad knee or a bad back and may have taken it for a long time, or Norco or whatever. But if you're impaired, if it impairs you while you're on the job, you cannot take it while you're on the job. So ultimately, that's going to be a policy and procedure thing with your healthcare agency. But if you do show up impaired, they can report you to the Board of Nursing. Of course, they can report you for most anything. And they do. And many times it's frivolous. You know, we recently looked at one, I mean, it was totally unsubstantiated, but, you know, some, not even a patient, but somebody that knew a nurse was mad at the nurse, and so they sent us a letter and said she was a crackhead. And she did crack and marijuana all the time with his wife. And I thought, and you too, I bet. But there was nothing to substantiate that the nurse had done this. We did an investigation. You know, she had random drug screens from her employer just as part of the employment process, and she had had the same job for X number of years. There was just no evidence to prove, and we closed that case. So many of our cases just get closed, and then some we, you know, have to take further. But you know, everything is a case-by-case basis. We look at everything, and that can take some time. So you see that that's why we have our hearings are full on Wednesday and Thursday before the board. So I'm gonna let Talisha come up here, and so that's just a few things about the license, how to keep the issues that we see the most of: drug diversion, documentation, lack of communication, and acting outside the scope of practice. Okay, doing things as an LPN, performing RN scope of practice skills. Or as an RN, doing something that while you legally can do, guess what? You've never been trained. You know, you can't just go put in a peg tube anytime you feel like it if you've never what? Been trained. You know, it's not outside your scope of practice, but you have to be trained. If you've been trained in school to do an NG tube, RNs, LPNs can both put down nasogastric tubes by law. But if you've never done it on a live human being, chances are, would you want to run down the hall and do that by yourself the first time? So you have to take some responsibility for understanding that you have to be, and it's not just trained one time. You have to be educated on how to do something, and then you have retraining to make sure that those skills, you remember how to do things. Okay? So those are the things, and we will be posting a decision tree on the Board of Nursing website in the near future that is a practice decision tree. And basically, we get a lot of questions every day. I get emails. Can I do this? Can I do that? Well, the law is not specific as to can you do this or can you do that. And so we have some frequently asked questions and some position statements that we've created based on a lot of questions that we've gotten. But the decision tree, it starts out, number one, have you been trained to do this? If yes, then you go to the next bubble. If no, you go over here. If no, it says stop. Request help from your supervisor. Y'all, we've had calls to the Board of Nursing from inside a patient's room from a nurse that has said, my patient is dead. Do I need to do CPR? We've had nurses who send us pictures. This is a picture of my patient's PEG site, insertion site. Is it infected? We don't answer clinical questions, okay? Anything in clinical that occurs, realistically, if you have a question, you need to go to who? Your supervisor. If you think you should perform CPR, you probably should. Always err on the side of caution. Okay, unless the patient is a no code. So there's things you need to know about patients before you go in their room. That's why you do all this training in school, to try to simulate what it's going to be like when you're a nurse out there on your own. Good thing is you're usually not on your own. Because nurses have to be supervised by somebody, okay? So you always want to have somebody to call. So I'm going to let Talisha Greenlaw is one of our licensing agents. She is absolutely awesome. She is going to talk to you about the application process, which I know that's what many of you, that's near and dear to you, because some of you, that's really coming up very soon. And then we'll be happy to take some questions afterwards. I am a talker, so I'll say.
That's fine. Before Talisha comes up, I know some of you may have a class. How many people have a 1 o'clock class? A few. Just quietly ease out when you need to, and we'll just keep going because I know what they're going to talk about, and you may have some questions. So just ease out when you need to. I don't have my clock, so when you need to get to your class, and everyone else just stay around, please.
A big misconception sometimes we have at the Board of Nursing is how you go about getting your license. So I'm going to tell you the very, very first thing that you would have to do is to apply. It means you would have to go online. You will go under applications and forms. Once you go under application and forms, it'll have examination by licensure. And then you're going to fill out first you're going to see some instructions on what you need to do. And after you read the instructions and you still don't have a good understanding, and you still have questions, you can always feel free to call us, and we will help you to understand anything that you don't understand. But once you get to the application part, we ask that you type it in. There's drop-down boxes, and the reason why we ask that you type it in is because sometimes a person's A can look like an O, and we'll put your name in wrong. And when we put your name in wrong and you go to look up your information, you're not in there, and you panic. And it's because we put your name in wrong, because what we thought was a certain letter was not. That's why we ask that you type it. Not only that is that we scan the applications in, and it does not pick up handwriting. So that's one of the reasons why we ask that you would please type your application. Once you have your application in, it takes about 7 business days in order for us to process it. That's from the time that I actually get it in my hand. I'm not bragging, but we are pretty quick. So even though we tell you 7 business days, sometimes you can go on there and within 3 business days, you can go to student status and you'll see your information that's on there. If for any reason when you go under student status and your information is wrong, for instance, your school, or we spelled the name wrong or anything like that, please let us know immediately. Because once you let us know, then we can go ahead and we can correct the problem. And then at that point, you guys can just kind of go on smoothly. Once you have been put in our system, at that point, you're able to go online and you're able to register for your background check. You cannot register for your background check until you are in our system. We have to have you on file. We have to have a record of you. So once you are in our system, again, you can go back to your student status, and student status is for you. So you'll be able to keep up with, do we have your transcript, do we have your applications, all of that we update as we get that stuff in. So once you are in our system, you can go online to register for your criminal background check. Once you have registered for your criminal background check, that department gives us like a little ticket, sort of say. And that's just to let us know that you have done it and that you're good to go. If for some reason the background check comes back and they need more information from you, the criminal background check will contact you. We don't handle that as far as anything that they may need from you or anything like that. You would probably talk directly to Mr. Dwayne Jamerson, and he would tell you to send whatever it is that you need to send in. Once you send that information to him, then he would notify us, and we'll make a note on our in to know that everything is good and clear in order for you to be licensed when that time comes. Another thing is the next step that you will want to do is to make sure that you have your transcript sent to us. Please, please, please do not request your transcript until after you have graduated. The reason why I say that. Oh, okay. Good. The reason why I say that that's so important is because some schools send us their transcript before they graduate and they have no graduation date or no degree on there. We can't use it. We have to have proof that you actually graduated and that you have a degree. So once we have that, so once we have your application and once we have your transcript, your official transcript, at that point, you have now become eligible to test with NCLEX. However, before we can make you eligible, you will have to go on and register with Pearson VUE, and that's $200 in order for you to register with them. Once Pearson VUE lets us know that you have paid their $200 to them, at that point, we will go in and make you eligible. This is one of the things that some of the students get a little confused on, is because nothing is real time. So for instance, if you were to go and you were to pay Pearson VUE today, your $200, some students call us an hour later and say, I paid Pearson VUE. We don't get it that fast. Everything has to update. Everything has to update. So once it updates, we'll go in and check to make sure you pay Pearson VUE. And then once you pay Pearson VUE, then we update our system and you'll be sent an ATT. You'll be sent an ATT through whatever email address that you gave Pearson VUE when you registered. Once you receive your ATT, that opens up the schedule, so to speak, and you'll be able to find out what dates are available and what place that you can take it in. You can take it anywhere in the United States that you want to take it. You just have to specifically state that you're taking it for the state of Mississippi. So if you're in Rhode Island visiting relatives and you want to just go ahead and take your test there in Rhode Island, that's fine. You can take it there, but just make sure that you're taking it for the state of Mississippi and not for Rhode Island. Once you have taken your test and you're successful, again, we have to wait until that information is updated. So if you took your test on Thursday, we may or may not have your results on Friday. And sometimes you and a friend may take your test on the same day. That does not mean that we'll get your results the same time we get your friends, because sometimes we get that. A student may call and say, well, I took my test on Thursday and my friends already got their results back and I have not. We can't do anything until Pearson VUE releases your results to us. And depending on the time that you took it, Pearson VUE may not release your results the same time they may have released your friends' results to us. So we just ask that you be patient. We try to work very quickly and efficiently so that we can go ahead and get you all licensed in a quick manner. Once you have taken that test with Pearson VUE and you're successful and you pass, you can go out to the website under license verification. Your license will be there. We do not send out any hard copies of your license, but you can go there to check the website. We will, however, send you out a notification to let you know that you have passed, along with the letter and along with a certificate that you can get a pen, a little nursing pen if you want to, or a wall certificate. All of that will be in that letter that we will send out to you. And we'll also have your license number on that letter. So you'll get two things. You'll get your license number will be online under license verification and that letter. Those are the only two things that the Board of Nursing sends out, no wallet cards or anything like that. If for some reason you have taken your NCLEX and you're unsuccessful, at that point the process starts all over again. you have to resubmit to the Board of Nursing another application. That's your ticket, that's our way of knowing that you're ready to retest. And each time you're unsuccessful, each time you have to send us another application. The application fee is $100 for RN and it's $60 for LPN. And each time you're unsuccessful and you want to retest, you have to send that fee as well as the application. You also have to pay Pearson View again each time. You do not have to send us another transcript because we will already have that on file. Your background check will be good for 2 years, so we will already have that on file. However, those are your 2 things that you would need to do. And we will also send you a letter stating that that's what you need to do when we send you your results as well. Something else that I would like for you all to keep in mind is that, again, that it's not real time, so everything has to update. Your license will be out there within 24 to 48 hours after we have completed the process. Normally, whenever we get the results, it takes us about 3 to 5 business days. It can take 7 to 10 business days depending on the peak season. Our peak season is in December and in May because we have so many students that are graduating that a lot of times we can't get them all done as quickly as we would normally do. So again, we ask that you be patient with us. If for some reason you have any concern about your license, if it's been what you may think is way too long, please feel free to call us because several things could have taken place. If for some reason on your application you mark yes to any of the disciplinary questions, for instance, you had a DUI, and you would have to mark yes to that question. It automatically goes to investigation. When investigation gets that, they will require certain court documents from you. We have to hold your license until you have been released from investigation. An investigation normally will not release you back to the licensing department until you have met all their requirements. Whatever it is that they may need you to send any type of court papers or anything like that, the sooner you get those in, the better. Because when you get time to be licensed, it's just to be a smooth transaction, and you can go ahead and be licensed in a timely manner. Again, if for some reason you would need to contact us, the other lady that works in my department is Angela Dennis. We're the only 2 that work in that department. So it's 2 of us that have to handle a large number of students. But again, any questions that you may have, feel free to ask us because we're there to help you. We want to make sure that you get your license in a timely manner and that everything runs smoothly. Did anybody have any questions as far as how the licensing process goes? Yes, ma'am.
Would you tell the students a few common things that might prevent them from getting a license? They may have completed the program, but they're not eligible to take the license, or maybe they had something come up in their background check that prevents them from being able to get a license.
If for some reason you mark yes on the disciplinary questions, you're still able to sit for your board. You're still able to sit for the test. If you pass and yet you have not been released to us, it could be that the background check department is waiting on some court papers from you. It could be that they have to take it to case review, where they actually have to review your case before you're issued a license. If that's the case, sometimes an individual may have to be turned over to the legal department, and legal would have to investigate a little bit more. It's not saying that you would never ever get a license. Sometimes it just could be a little delayed because of maybe something you've done in the past. Sometimes we do things in the past and it comes back and haunt us a little later on, which we regret. But sometimes that can be the case. We're not saying that you will never ever get a license. It could just be that there's some steps that the legal department or the investigators would have to do just to ensure the safety of the public. Okay? Yes, ma'am. You can go to that state. If you want to just go ahead and apply for that state, that's fine. You can do that. Any other questions? Yes, ma'am.
Could you explain to us about the compact states and what is involved in transferring your licensure to a state that's not within the compact state?
If for some reason, Mississippi is a compact state, so you are able to, and I get confused on this myself too, so look, I'm gonna take a minute and think before I speak. But if for some reason, say you move to Texas, when you move to Texas, which is another compact state, you would have to get a license there in Texas. You would have to work in Texas. You would have to get a license in Texas. Your license then now in Mississippi becomes null and void because Texas is now your primary state of residency. However, if, Kathy, correct me if I'm wrong, however, if you are in Mississippi, which is a compact state, and you could work in another compact state off your Mississippi license. So as long as Mississippi is your primary state of residency. So if you are still living in Mississippi, still paying taxes here as your primary state of residency, and you're doing, let's say some travel nursing or something like that in Texas, then you can still work off that Mississippi license in Texas. But at any time you decide that you're moving to Texas totally and that's where you're gonna live, then you would have to get a Texas license.
Whenever you change your primary state of residence, you have to get a license in that state. That's just how it operates. The other thing is, when you are operating under the compact license, all of you would be, if you live in Mississippi and you want a Mississippi license, you would be issued a compact, a multi-state license. But let's say you live close to Memphis, close to Tennessee, so you want to work, you live in Olive Branch, but you want to work in Germantown. So you can work in Tennessee off your Mississippi license, but what you need to be very aware of is that you follow, whatever state you're in, you have to follow the rule, their nursing practice law, their rules and regulations. And nursing is not the same necessarily from state to state. What you can do, what you can't do, particularly that is the truth for practical nurses. Okay? Because what Tennessee may allow you to do in Tennessee, you may not have been trained to do in Mississippi, so you would need to be very aware of that. If you get IV therapy certified, an expanded role of IV therapy, that is only good inside Mississippi. Expanded role doesn't cross state bounds. Just like an advanced practice nurse is certified in an expanded role, that's not state, that's just, the expanded role is just for Mississippi. So what we probably have more problems with is people from other states, like someone living in Germantown, and they have a Tennessee license, and they come into Olive Branch to practice nursing, when you're disciplined in another state, then we investigate that. And it is likely that you would also be disciplined